Hi, everyone. I'm Carter Lebares. It's really an honor for me to be speaking with you today about one of my passions, which is mindfulness mental training and surgery. I have no disclosures. So, objectives, I will just sweep through this, but the upshot of what I want to tell you about is how the universal stress response relates to resilience, define how physician well-being as a complex state depends upon individual traits, workplace systems, and the environment to help dispel some of that passionate argument about which one of those things is the most important. They actually all matter together simultaneously. And then how does mindfulness-based mental training purposefully develop individual resilience? And then finally, I'll outline some of the evidence supporting mindfulness mental skills as fundamental cognitive tools for optimizing surgeon longevity, performance, and satisfaction. So we all know surgery is stressful, excuse me, but not all stress is the same. So as we were just hearing, you can have one hard case where you leave feeling challenged and exhilarated. You can have another hard case where you leave feeling demoralized and crushed. And often what makes the difference is not a quantitative magnitude of more difficulty, but rather the resources that we bring, both our internal resources and the resources that are in existence around us, and whether those are up to meeting the demands of the stressor that we face. And this idea of our resources versus the stress or the pressure that we're put under and how we perform was first proposed by Yerkes and Dodson back in 1908, and it's represented by this inverted U-shaped curve that shows the relationship between performance and arousal or stress. And what's important about this is just to note that this is a continuum. So in other words, on one side of this curve, stress is debilitating and deteriorating. It's toxic and is overwhelming our resources. But on the other side of this curve, stress is challenging. It stimulates us, it pushes us to mastery. And the good news here is that because this is a continuum, we can move along it. And because we know that resources play a critical role in how we manage stress, we have targets that we can focus on for how to help us move along this curve. So we are all overly familiar with what it looks like on the toxic negative side of this curve, and that looks like, in one manifestation, burnout. We know that this touches all kinds of things, personally, professionally, and economically throughout medicine. I don't need to go into those because I think we've all heard about them a ton, but suffice to say that the cost, personally and financially, is huge. What we hear less about in a detailed and constructive way is physician well-being. And in response to this sort of vague but seemingly important concept, the National Academy of Medicine got together in 2017 and they convened the Action Collaborative on Clinician Wellbeing and Resilience. This involved 200 plus organizations with representation of experts from human systems, engineering, branches of medicine, healthcare organizations. And what they did was to review the extant literature on burnout and what they could find regarding well-being, and to come up with this conceptual model, which is important because it begins to show us how complex this issue is. On the left side of the picture, it shows the role that internal and external environments play on the amount of well-being that an organization or an individual experiences. So this can be your institutional values, or it can just be the external culture of your society. And between those influences and individuals are the workplace systems that we interact with. And these types of systems can either be human-centered, meaning they're responsive to us, they take into account what we need and then reflect those needs, or not. And that disc in the middle between those factors and systems and the outcome of either burnout or professional well-being is the individual. And purposefully the individual is depicted here like a lens, because we either magnify or diffract or block what goes on with those other things. And our capability in dealing with those stressors is really the product of partly our disposition, partly our coping skills, which can be innate or learned, and then partly our resilience, which it turns out can be innate or learned as well. This was riffed on in 2021 by the second trial designers, and you can see here, it's a very similar diagram and similar conceptual framework that just tries to put the same types of influences and pieces together for well-being for resident trainees. And so the complexity of those diagrams really reflects the complexity of how well-being is being discussed and defined in its modern conceptualization. And probably the best definition is being put forth, in my mind, by the Centers for Disease Control, but this is also echoed by the World Health Organization, where it describes well-being, whether it's for physicians or others, as more than physical health and housing. Well-being refers to the quality of a person's relationships, their positive emotions, their sense of resilience, realization of their potential, and overall satisfaction with life. So what's important about this is to just note that it's A, complex, and B, that it involves individuals, systems, and organizations. And so really when we're talking about physician well-being, what we're talking about is an entire environmental and system construct where the individual's role is just one part of this. And to help promote sort of the effort that addressing, defining, learning to work with such a complex system requires, there's been an increasing advocacy to point out that there's a business case, a financial imperative for investing in physician well-being, which has been most famously championed by Tate Chanefeld, and then also more and more coming out about how patient safety is actually a matter of clinician well-being as well. We're also beginning to figure out the metrics of well-being and how to measure this process so that we can bring to this issue the kind of rigor that it deserves. So the mental health continuum, which is a 14-item categorical or continuously scored instrument, it's been around for a long time. It was developed by Corey Keyes. It's defined as representing positive social, emotional, and psychological functioning. And so you can see mirrored there this idea of the individual, systems, and culture or institution. And throughout this body of work that spans about 30 years, Dr. Keyes and his coworkers have demonstrated that there's a lower risk of future mental illness, healthcare utilization, suicidality, with higher mental health continuum scores, greater job satisfaction, and better academic performance also associated with this. We've also recently seen some evidence of validity for this instrument in general surgery residents. This figure that you see here is work that was done by Srijan Sen at the University of Michigan, just demonstrating that following 1,600 interns, about a third of whom were surgical, over a year, that their flourishing scores predicted their mental health. On the other side is simply a table taken from this study looking at the validity of this measure in general surgery residents, which just shows that flourishing as a categorical score taken from this instrument correlates positively with established resilience factors that we've seen in surgery and negatively with established risk factors that we've seen in surgery. And because eventually this does become a talk about mindfulness, I want you to notice the red arrow, which shows a moderate, although significant, impact of mindfulness on flourishing. So, getting back to the topic of this session, what does it mean to thrive? So, individual resilience is one component of well-being, as I was just describing, but certainly well-being as a whole is really felt on the individual as the experience of thriving. So well-being is something that involves individual systems and culture, whereas thriving is the experience that the individual has. And what this looks like is a person encompassing joy, satisfaction, connectedness, and purpose. And you can see how this mirrors those domains of social, emotional, and psychological health. And frequently, those who are resilient look like they're thriving, and that's really because they are one and the same. Because we know that resilience and thriving isn't just a phenotype. It isn't just how you react, how you interact, how you look. It's actually characterized by a set of cognitive skills. And this comes from fascinating research that stemmed from resilience science. Really, its origins was in the 1990s, coming from studies of adolescence. But this work depicted in this cartoon came from studying military veterans, where Fetter and Charney looked to see if particularly resilient military veterans had different pathways within their brains that they used in order to address stressful circumstances. And through functional neuroimaging, they demonstrated this preferential activation of the reward circuit when stimulated by high-stress situations, which associates pleasure and a desire to move towards a challenge rather than avoidance and fear. And these cognitive skills specifically are named as having a positive affect, being non-reactive, and reframing events, which just happen to have shown up in both our talks about coaching. And so the reason that these cognitive skills are so powerful is because they work on this very central and universal process, which is our stress response. And very briefly, what we know is that information comes in from the outside world, our mind takes this in, we have some type of physical reaction because this information is somehow stressful, and it doesn't matter what that event is. Our palms get shaky, or sweaty, our breathing might increase, our visual acuity might heighten, our heart rate might increase. And whether this is seeing someone we love and are excited about or something that terrifies us, our body reacts the same way. But while we might run away from a mad dog or a fire, we don't run away from bleeding in the OR. We do something with our minds to change how we see the situation. And what that process represents is the ability for the mind to mediate our stress response and not simply react, but respond. And as it turns out, somehow, through mechanisms we're really still just beginning to uncover, this process of the mind mediating the stress response is strengthened through mindfulness training. And so mindfulness training specifically is a cognitive process of bringing one's attention back to experiences as they occur, observing those experiences without reacting, and it's a way of training our minds to do this over and over again, and eventually developing a different way of perceiving, particularly stress. And really, this is a process that requires reiteration. So just like any other type of skill, just like any other type of thing that we want to become strong at, it needs to be done over and over again. These are mental push-ups for the mind. But the result is that through mindfulness training, through these mental push-ups, we end up able to live on that upside of the inverted U-shaped curve. And so really, this is what it looks like to thrive. And for many of us, we know this, at least in glimpses, because it's also what it feels like to be in the flow. And so what we're talking about really is an internal curriculum, one that is developed to help the individual maximize their sphere of influence in this larger issue of physician well-being. But it's only one part of influence. It by no means diminishes the importance of pursuing any of the other things. So we took these ideas in mind, developed a codified mindfulness-based training program tailored to surgeons. And for the last few years, we've run 2 single-center randomized controlled trials. And in the process of that, we've discovered that this training is certainly feasible. Residents are able to practice about 15 minutes a day, about 5 days a week. We've seen benefits to mindfulness, which is hard to interpret what that really means, but also global executive function. We've also seen benefits to aspects of burnout. And interestingly, we've seen when confronted with a stressful emotional regulation task, this preferential recruitment of specific parts of the brain only in the group that received the mindfulness training. And one of those parts of the brain includes this executive control hub that I mentioned before, the prefrontal cortex. We've also seen mitigation of the physiologic stress response in terms of a downregulation of pro-inflammatory gene expression in those who underwent training. And then more recently, a real-life application where we measured anxiety levels in our resident body during the first surge of COVID. And we were surprised to see that there was actually worse anxiety in more senior residents. And this was confusing because, as many of you might know, anxiety tends to actually go down as people progress through training. But then we reanalyzed this a little bit differently, looking at those who had received mindfulness-based training and those who had not. And it actually turned out that because we've only been doing mindfulness-based training at UCSF for a few years, in fact, it was not available to our more senior residents ever. And so what we saw was a 6-fold higher likelihood of those who had not received mindfulness training having clinically significant anxiety. So in the interest of time, I will zip through some of this, but simply to say that it's no longer happily just my group that's publishing on the benefits of mindfulness, that there are now multiple groups out there that are looking at things such as systematic reviews of subjective and objective benefits in surgeons from mindfulness training, as well as the effects of mindfulness training on inattention bias in surgical simulation, the effects on empathy, burnout, aspects of professionalism, the benefit of mindfulness training to help during the COVID pandemic, and then interesting work that's some of the most exciting in my mind, looking particularly at flow state and perceived stress in the live OR with surgeons, anesthesiologists, and surgical trainees. And then I could go on, but I will not. All of this work in surgeons is directly mirrored in work in multiple other high-performance fields. This includes the military, professional athletes, parliamentarians. So I would just leave you by saying, that physician well-being and mindfulness as one part of it really represents an innovation in surgery. And like many of the other innovations we've seen, such as duty hours, skills labs, safety checklists, it's been quite a struggle to promote these things. It's been disruptive, people haven't liked it, there's been a lot of argument. We've talked about how it's destroying the field. But in the end, now, duty hours are essentially inviolate. Skills labs are a central part of every self-respecting training program in the country, if not the world. And safety checklists are as integrated in the operating room as making an incision. So my hope is, as we move forward, that this will become true of mindfulness-based mental training, but also the seriousness with which we take physician well-being. Thanks.